Well, good evening and welcome everybody. I am so thankful that you're here and I hope you really enjoy tonight's presentation on all things turmeric. Tonight, we're going to talk a little bit about what is turmeric, the research that's been going on with turmeric, a little bit about supplements, as I'm a vitamin and supplement expert and the owner of Boston Natural Products. I am very interested in supplements, and we're going to take a look at the good, the bad, the ugly, breakthroughs and recommendations. And finally, if I haven't answered your questions, we will do it then. All right, so I do want to begin with a medical disclaimer though. This seminar is for education and information only. I am not a doctor. I am a chemist. And as a chemist, I devote myself to understanding how nutrients and our biochemistry cooperate and how that benefits using nature, our body system, so we can have that transformational benefit from any supplements we may use. Only a doctor can diagnose, treat, mitigate, cure diseases, and so none of this should ever be interpreted as a substitute for a physician's care. So with that said, who am I? Well, I have had the honor to have so much fun and been able to jump into so many great opportunities in my life that I've had this most amazing career. It started, I have a BS from Western Illinois University that's certified by the American Chemical Society. I have a master's from Harvard University. I've had just so much fun with my employment. I worked for the USDA dairy grading labs. I worked for Kraft, like America spells cheese, although our side made the Miracle Whip, the mac and cheese and things. So I learned a lot of waste management, quality control, and lab management there. I worked on a project called CoAlert, which is a USDA approved product to detect coliform bacteria in drinking water. So that's where I learned my microbiology and my water quality. And finally, I worked at Yale University. We were working with drug therapies for addicts. So that's where I learned my toxicology and brain chemistry. So, and then I had short programs at Dartmouth, Oregon, and at the National Science Foundation. So I've had fun. I've been around a little bit, but I've put that all together into Boston Natural Products. And I've been doing this company since 1999. And I am here to, I do support and sell products, very high quality products, and especially work with clients on consultation. So again, to do that like real transformative, risk reducing, great life, well into our 60s, 70s and beyond kind of, preventative work. And so how I like to say is, when we start getting old, we tend to start going downhill with our health is the usual track. But what if we could even the plane or maybe even go uphill if we can to really change life around? And I have seen that happen so many times. But tonight we're talking about turmeric, right? This is, what is the buzz about turmeric? Well, it's been used in Chinese herbal medicine and Ayurvedic medicines for, thousands of years. And it's been used to cleanse the body, for anti-inflammation, pain relief, breathing aids, liver detoxing. And the Chinese talk about it in terms of helping the blood move through the body well. And so this is, it's also delicious in food. I don't know if you enjoy your curries, but ooh, believe it or not, unplanned, I actually ate a chickpea cauliflower curry today, and it was delicious. For my friend's daughter made some for us. So there is a rapid growing body of research around this. There's been thousands, tens of thousands of studies done on animal and cells. There's been comparatively very few on humans, which is interesting. And considering how much it's been a buzz for about 5 years, there's only a few hundred studies, and most of them are treatment studies. There's even fewer preventative studies on turmeric, and we're going to talk about some of those. And all the benefits of all these research points to something in turmeric called curcuminoids. And these things seem to be so powerful, these curcuminoids, that drug companies are trying to hop in on the bandwagon. But the good news is nature's done a very good job providing us with some powerful nutraceutical molecules. So we're going to talk about what they do. First, let's talk about, you've heard turmeric, you've heard the word curcuminoid. What's the difference? So in turmeric, that is the plant, and the active part of the plant is the root. Okay, just like ginger, it's active in the root. What we do is we tend to grind the root, and then make it becomes a nice powder, and that's what flavors our foods. The thing is, the active compound is called a curcuminoid. And I am showing the top 3 active curcuminoids from turmeric root. In turmeric root, there's only 1 to 6% of these active compounds. It sort of depends how it's grown, what's going on with the year it's grown, blah, blah, blah. But the 3 active metabolites of of turmeric root is curcumin, the base, dimethoxycurcumin, which is formed when this curcumin goes through first pass through the liver, and second pass we get bis-dimethoxide curcumin. Dimethoxycurcumin. Sorry about that. And then it keeps going. There are other metabolites, and the molecule keeps getting broken down, and they're just not as active. So these are the 3 stars. All right. So what are these 3 stars doing? There has been just a wide range of research and benefits these curcuminoids seem to be able to deliver. Again, most of the research are on cell studies. Many of the human studies are on disease, but we are really focusing tonight on the preventative studies. The cool thing is, there seems to be some early work on allergies that is really neat. So we're going to start with immune regulation. So somehow we're able to, curcuminoids seem to be able to help and reduce allergy symptoms. There seems to be some help boosting the activity of antibiotics, which could be useful, or even breaking down the biofilms that people on long-term antibiotics can actually end up building, and which makes the antibiotics much less effective. So that's going to be interesting. There is currently, imagine this, really, really big interest in antiviral activities of curcuminoids, especially from Indian researchers. Again, Ayurvedic medicine has used this for antifungals, antibiotics, antiviral compounds for millennial. And so now they're starting to do some publishing in big research and in big research journals. So that's going to be very interesting to see how, and that it's all about the current, COVID-19, and can we mitigate some of the symptoms. So that research is being done. This stuff seems to be really potent anticarcinogen. In cell studies, we have found 4 pathways that it can be an anti-cancer agent, and that's very exciting. I like the neuroprotection because we have good human studies, even in memory and drug-resistant depression, which has really been a problem, but turmeric seems to be really helping there. And oh my goodness, of course, digestive effects. There's been treatment studies with colitis and indigestion, reduced inflammation of IBS, and even colon cancer. So this stuff is a star molecule that gives so many benefits. In prevention, one really big thing is it seems to really have effect on balancing blood sugar. And I saw one small, long-term and really well done study on diabetes prevention. So 2 groups, one group had, they both had pre-diabetes symptoms, and one took turmeric and the other group took placebo. And In the placebo group, about 16% of the participants moved on to diabetes in the first year, but nobody in the curcumin study or the turmeric study moved on. So one question that I always think about is, well, if this stuff is so good, why are we not seeing more studies? Why are we not seeing more prevention? Part of it is the amount of turmeric people have to take for these benefits is out of this world. We're talking, these treatments have been 8,000, 10,000, 12,000 milligrams a day, and sometimes more than once a day. They're eating a lot of turmeric or turmeric roots. And here's the key. There's been some really great breakthroughs that are making this ability to look at more human studies and more prevention possible. I'm going to talk about those in a little bit. But first, let's talk about supplementation. What's out there? What do we know about it? Well, in Arizona School of Medicine and Vanderbilt University got together and they looked at, along with consumerlabs.com, 106 brands of turmeric. That's a lot. They must clean everybody out. And what was interesting is some didn't even have any of the active curcuminoids in there, which was really interesting because there's too little. Remember I said between 1% and 6%, you know, what if it was a bad year or a poor, you know, preparation or whatever. The United States Pharmacopoeial Society has certain standards. And this organization has been in business since the 1820s, trying to help us assure minimum quality and safety standards. Well, you can see that 35 brands didn't even make 80% of their label claims. So if the label said 100 milligrams of curcuminoids, 35 didn't even have 80% of that. So their label claims and what's in the product were not matching. And 59% didn't meet basic testing for like lead or mercury and other safety standards. So that was pretty concerning. But the thing that blew me away as a scientist is that 75 or 71% of these products had residual class 1 or class 2 solvents. Well, what does that mean? Class 1 are carcinogenic solvents. This is things like benzene. You know, you're never supposed to, you know, be eating benzene or exposed to benzene. In a lab, if I needed to use benzene, I'd be in a hood and gloves and all sorts of things. Class 2 solvents are things that could be, you know, cause probable health issues like acetone. That's another thing, you know, we used to use it in the lab all the time. That is such a no-no right now. Without proper safety equipment. You don't want that on your skin. A class 3 solvent are things like alpha alcohol or water or carbon dioxide, like liquid carbon dioxide is a great solvent. So those are safe. And that's what people should be using, those food grade safe solvents. So this was very concerning to me. Labels can be very confusing. And in this paper, by Arizona School of Medicine and Vanderbilt, they quoted, turmeric supplements were formulated to deliver vastly different amounts of curcuminoids, an attribute that could not always easily be deduced by consumers from information provided on the label. I concur. As I've gone out there, I have probably examined 20, 25 products at this point, and I'm seeing the same stuff all the time. What's interesting, brands that have very high curcuminoids, this study, when they looked at brands and price and what they were saying they had in the product, they came to the conclusion that most of the higher curcuminoid level supplements had they had to have had synthetic curcuminoids in the product. And that means natural doesn't always mean all natural. And that's very serious because the synthetic curcuminoids are really cheap, but they're made from oil products. And, you know, it's like, who's standardizing this? And they're not claiming it on the label, but it was the price that was the indication, because these technologies cost something to make it, you know, to be all natural. And finally, some of the products, we know piperin is a black pepper extract, and it's, which is a wonderful, I mean, black pepper is a fantastic anti-inflammatory antioxidant on its own. But a study was done, in 1998, where they had two groups of people taking, 2 grams of turmeric powder. And one group had no piperin in content in their formulation, and the other one had 20 milligrams in their preparation of 2 grams of turmeric. Well, the difference in absorption was like 2,000%. So that was really interesting, and they determined that by blood levels. So that was actually somebody's question, so I really wanted to bring that out. So piperin is a really good enhancer for bioavailability. All right, so that's not very good news. So when we start looking at reviews and people's top picks, well, what does that mean? Well, I'm going to talk a little bit about consumerlab.com, which I think is a really, oh my gosh, that company has very high integrity about when they talk about their top picks. They really are trying to make great recommendations based on, they look at price. In this case, in the turmeric and the curcuminoids supplements they looked at, they were looking at disintegration, how fast does it break apart. They verify labels that see what is on the label is actually in the product. They do a lot of heavy metal testing. They look at absorbability, and they definitely look at price. But it's interesting. What does this really look like? Well, one of their top picks was, was Doctor's Best brand of curcuminoids. It is super cheap and seems to have a ton, 95% curcuminoid content. So it almost looked a little too good to be true, because again, that price and knowing what University of Arizona and Vanderbilt had discovered. So I kind of started digging in a little deeper about that brand to see, all right, let's see, are they consistent with other products? Well, what was their track record and what are they selling? Well, they're selling joint products with chondroitin, and chondroitin works really well if you inject it into a joint. It can really be helpful for inflamed arthritic joints, but not so much when you take it internally as a pill. They sell collagen proteins, which have been shown to really help hair and nails, but it's not, it's an animal product and it's not as effective as other kinds of powder protein. They sell vitamin C in 1,000 milligram tablets. For me, that's a no-no, because I know we can only absorb about 100-ish milligrams of vitamin C in any 1 hour. So a good brand is going to have a sustained release, but in this brand, you're going to pee out 900 milligrams. They are selling products that don't have a scientific body of research behind them. So they are too cheap. And I'm seeing in other products, well, they're not as committed to science and starting with science as they should be. And they're certainly not using the higher level of biotechnology and the technology required to get these things in our body to the right place where they're going to work. So, good choices are rare. And the key is, how does a company source those quality herbs? How do they pick the research that is going to show them the better benefits? How are they going to deal with this bioavailability of turmeric? How are they going to assure the safety and assure the quality? And how do you make an all-natural product? So these are some of the questions good brands will look at. So let's look at some store brand competitors. I've got 3 that are kind of off the shelf, like you might get at a drugstore or a big box store. And I have a couple too that you might get, you know, at a whole, you know, a kind of a natural food store, or it's hard to say. I used to be able to just literally say a Whole Foods kind of store, but now that's a brand. So, you know, like, but, you know, good stores, they're trying to sell you good products. And you can see, like, you can see the amount of turmeric root, right? And that's kind of all over the place. But what we really want to know is how much turmeric extract, how many curcuminoids are going to be available to actually get, you know, for your body to absorb. And that's kind of like, it can range from, I have seen 3%, 6%, all the way up to 95%. And, you know, like in this group that I have right here, you can see the one brand new theory is actually very high in curcuminoid and doesn't have root. So they do the extraction process. But when you look at it, somebody said that there were 40 in the, I got this, most of this information from another source. And, you know, they said 40 servings in a tablet, 1 cap per serving. That's not, when I looked at it again, maybe that one product was replaced, but I saw it was 60 in a bottle and 3 caps per serving to get that 450. So it really, again, like, how do you look at apples and apples in there? So at this point, I would probably take personally a closer look at the youth theory product and, you know, kind of go from there. But I do know it ends up at about 68 cents per serving because it's a 3 capsule serving. But again, these don't have this, the store brand competitors don't have the type of technology. And I really want to talk about what raises a product to the creme de la creme. You know, what makes these products, these 4 products I'm talking about, really rise into a new level where we can be a little bit more confident at our, at what's being, you know, what we're taking and what benefits we might accept or expect. So there are 4 kind of big technologies out here, and these products is, you know, just an example of the 4 that are out there. One is, the first one is the Thorin Meriva, and that is a formulation that uses turmeric with lecithin. And lecithin is a type of fat and vegetable fat, and you can find it in soybeans and eggs. And when they use technology to put these, you know, kind of like attach the lecithin kind of in a way to the curcuminoids, so it enters into and through the intestinal layer, you definitely get some more benefit and bioavailability. Matter of fact, this product, this technology has been shown to have 29 times better absorption of the curcuminoids in humans compared to the other standard extracts. So it, you know, that 180 to 200 milligrams is going to act like several thousand grams of turmeric powder, which is pretty cool, right? Nordic Naturals uses a technology by Long Vita, and that's an encapsulated. They actually take what are called lipids or fatty acids, and they attach that to their, again, to the curcuminoid. Now, why they do that is curcuminoids do not dissolve in water, but if they can attach a fat molecule or surround the turmeric root with this fat particle or this encapsulation, you can extract those curcuminoids out of the root, and that will increase bioavailability also. I couldn't find the exact data about exactly how many times more, but they were able to show higher blood levels. Better Curcumin uses a technology called Curcumin, and a couple products use this, but they use nanotechnology. So what they're doing is they're breaking down these turmeric powders into much smaller, like 100 times smaller than normal turmeric. That's pretty cool. And they are able to get, you know, that 90 milligrams is like 27 times more absorbable than it would be with standard turmeric powder. So that's an interesting technology. And finally, the Shaklee Turmeric Boost brand, they use a natural, they're one of the few guaranteed all naturals, and they use an extraction process. Their big thing is they usually use things like cold extraction, that liquid carbon dioxide, and they also use molecular distillation to concentrate things. So they were able to make it without the synthetic curcuminoids. And they use, their enhancement is piperine, which is black pepper extract. They found 5 milligrams is the right amount. And again, that's that 500 milligrams of curcuminoid extract is about 20 times more available to get into the bio, you know, even that. So 500 milligrams, 20 times more likely to get into your body. Now we're talking about something making a difference. So I have a couple more things, but I want to stop and see if I have any questions right there as we look at the different technologies and the the competitors and things. Are there any questions about anything that's come up so far?
Not with just the turmeric, Susan, but I'm purchasing a number of different products from you. I'm curious about when I should be doing this, because I usually take them in the morning. Nobody else really cares what I'm doing, but there's B+, there's lecithin, there's omega fish oil, there's a couple of others that lecithin. So I just take them in the morning.
Yeah, I'm going to actually, at the end, I'm going to tell you how you can maximize the absorption.
Okay. Good, thank you.
When you take that. So great question. And I have another question that somebody, I had actually 3 people come up with questions. So I will definitely be going at that. Any more questions about just like the different technologies and the different ways brands go about what they do? Okay, so I'll go on just a little bit. There's not much left. All right, so there are 2 brands that I tend to I'll recommend, and they've gone through my rubric. I have a pretty stringent rubric. I look at, the company, I look at their quality, I look at all their products to see what are they doing across their platform. I have talked to the owners of both of these companies, and matter of fact, the owner of this company was shocked how vigorous my questions were to make sure she was doing, and meeting those standards, because I am not happy with just testing for lead and things. I talk to people about, what kind of pesticides, herbicides, fungicides are they testing? Because these are herbs, these are grown on farms. We do not want, various farm products in these final products. And even organically grown isn't good enough for me, because there's too much chance of cross-contamination, air pollution, water pollution that absorbs into there. I want to make sure that my standards are better than organic. So I really put the products through the ringer. Now, again, we talked about Better Curcumin's nanotechnology. They use a Chinese herbal blend to aid absorption. I hope I'm saying this right, because I'm not real familiar with Chinese herbal medicine. Matter of fact, I'm not. I have an herbalist that I ask if I need, and I wasn't able to get a hold of her today when I thought about this. But Chun Xiang, I think is how you say it, or Zhang, I'm not sure which pronunciation, is the Chinese herb that they use, as well as cinnamon extract, which cinnamon is another great antioxidant. So I also like that this company has been able to demonstrate longer blood levels than standard curcuminoids. It gets in there and it sticks around for, it peaks in about 2 hours, but there's still some curcuminoid in the blood, 8, 10, 12 hours, 15 hours later. So that's good. They're doing something right here. I also like that, you can see on the bottom, they're gluten-free, they're vegan. I don't have a lot of customers that can't take these if they want to try them. The other brand I really like is also, it's the Shaklee Turmeric Boost. Again, we talked about their technology, their enhancer using piperine that allows it to be 20 times more absorbable than standard curcumin. This is the product with the highest curcuminoids that are free and ready to get into the body. It is guaranteed all natural. I love this company's quality control on every new botanical. They run 350 quality control tests. It goes way beyond anything I've ever seen. And also, it's only one capsule a day. And the other thing that blows me away about this company is they guarantee their products. So people either use them and feel better, or they get their money back. Here's the deal, though. These products, turmeric, is something. Oh, I don't want to go there yet. Turmeric is something that it isn't a magic pill. This is all turmeric supplements work better over time. The research was really clear. The diabetes, again, long term, they're talking about looking at people 1, 2, 3 years. Anything like I mentioned the drug-resistant depression. Nobody even had any kind of inkling things were going on for 2 to 3 months, and then the effects start kicking off. It's because of, again, that bioavailability, but also it takes a while for the cells to respond to a supplement. A medicine, you're going to get a fast return. A supplement, again, you got to feed the cells. The cells have to multiply, divide, and then that takes 6 to 8 weeks. And then organs turning over, starts at about 7, 8 months. For the whole body to turn over is like 7 years. So we have to be more patient with supplements versus a medicine. And a lot of people don't realize, especially turmeric, is going to take even longer than most supplements. However, there is a point where now that we have these 500 milligrams of, like curcuminoids, or something with 90 milligrams curcuminoids, but acts like 27 times what would be in normal standard powders, is more better. If this is so good, should I take 1,000 milligrams? Should I take 2,000 milligrams? More is better, right? Probably not. Probably not. We haven't seen anything to show us that taking tons of this is, these curcuminoids is going to be anything more beneficial. I'm sure somebody's working on those studies, but we're going to be waiting a long time for those. But we do know that this powerful nutraceutical can affect people taking medications like blood thinners, high blood pressure medicines. Cancer, like tamoxifen, it actually hinders some of the liver metabolism of tamoxifen. But then again, like going to antidepressant treatments, like the SSRIs, like fluoxetine, or I'm sorry, Prozac is how you'd probably hear about that. It might actually help brain chemicals. So it's like, hey, but doctors need to know if we're taking turmeric. Again, a lot of turmeric might cause a little bit of diarrhea and gastric distress. All that said, what are some of the best ways we can get it? Oh my gosh. Food, turmeric, eating this regularly with fat and black pepper over vegetables is a wonderful way to eat turmeric naturally. Golden milk is fantastic. Again, you get a little turmeric, some other spices. It's usually served warm with milk. That's all really good stuff. And if anything looks good here, I copied these recipes down, and I'm glad to share you. Because, when you look at all this, remember, the way we've been eating this for millennia is with all those beautiful vegetables and the variety of food. Indian and Asian cultures have been doing this. So is it really the turmeric, or is it turmeric and these wonderful other foods that they might be eating it with? So again, let food be thy medicine first. But if you are going to take a supplement, take it with a meal, morning or evening. I haven't seen research that said either way, but I will go looking for that question. So that was a very interesting, Larry. I know with the meal, I don't know if timing really makes a difference. So I will go looking for that for you. It is best with vegetable oils, and lecithin, interesting that you mentioned that, actually has synergistic benefits with it. And it does work best over time. Now, I'm going to get to another question. Somebody asked me about glucosamine and turmeric. And it's a wonderful combination because, again, they work synergistically. So for the person that asked me, you know, what about these two together for joint? It works very well. So glucosamine is going to help maintain cartilage and kind of cushion that joint a little bit better. The turmeric, or a good curcuminoid supplement, is really going to help that anti-inflammation character come in, so to keep that swelling down. So I think they would work beautifully together. So I will end with this right now, and of course I'll take questions in a moment, but my question to you is, what kind of results do you want when you take your supplements? And if you would like to find out more about what I might recommend for you and your health goals, I would love to talk with you. There is my number, there is my email, and you know, I would be honored if you would consider, you know, buying your supplements through me, and I can guide you and give you service that, you know, well beyond what you might get from a pharmacy or other sources. So thank you so much. And are there any other questions that I might be able to answer?
I can make one comment. I have
Yes.
been taking these supplements, and we can talk about it after the specific ones, but I have tried them first thing in the morning with water, and then first thing, because I drink water first, then I'll go to food before I exercise the first time, where I put some protein in. That's when I take it in. And then the lecithin and the other ones, more of the fish oil with meals. With actual meals.
I'm thinking that sounds fine. Again, we want to make sure that we have a food carrier with some fat. That's really going to be helpful on top of all these other technologies. It won't hurt. Anything you can do to get this into your blood. And what I like about fat too is it slows down the absorption a little bit. Then, you know, so that's good too. Now, again, what's interesting, what it makes me think when I think about health goals, how I recommend and what I might recommend may differ depending on an individual's health goals. So I might recommend, you know, one of the products, like I'm thinking like if somebody was going for the antidepressive effect and maybe some mood relief, I'd probably choose one of the brands of the other. But if somebody was looking for more blood sugar benefit, that would change my recommendation. And if they had other medicines and things, it might change it again. So this is my value that I can bring, is to really think about lots of different questions to make sure that if you're going to take a brand, it's going to be the best thing I can recommend for you. So any other questions? Well, I said we'd,
Thank you so much.
Wait, somebody is speaking?
I said I'd email you.
Oh, that's wonderful.
Okay.
Well, thank you so much for joining me. I hope you enjoyed it. I would love your feedback. You all have my address, and you have a wonderful evening.
Thank you. Thank you so much.
Bye-bye.